It was late at the premier teaching hospital in the country, and we were overworked and overwhelmed. Those patients in most trouble had made it in, but many waited outside, a domino line from the threshold of the emergency room to the edge of the hospital. Those inside were on gurneys in the treatment areas. They were in the hallway, on chairs, or on the floor. It was the era of hyperinflation and terror in Lima, Peru. I was 1 year away from graduating from medical school. A corpulent and inebriated man came in with a large scalp laceration. One of my colleagues began to clean the wound. She misjudged whether he would need local anesthesia and did not use any. He responded abruptly and violently, taking a bottle with some colored antiseptic solution and hurling it at her head, missing narrowly. Her scream and the red, vitreous splash in all directions acted as the bat signal. Other doctors in training came rushing to her treatment bay. They first tried to restrain the patient. Soon the gang in white coats was holding him down and beating him up. When it was over, the man had the original laceration and the swollen, bruised, and cut face the class of 1995 gave him. What he received in punches, we also delivered verbally to anyone who complained and whom we chose to not simply ignore. This was our emergency room, and these people, the patients, were here to bother us, to interrupt us, to make our day more difficult. We dehumanized the laceration, the foreign body, or the appendix, without seeing the destitute and illiterate patients behind those labels. These subhumans were not only unfortunate and fortuneless, but in our eyes were also careless, irresponsible, and stupid. Like a potent drug, equal parts efficacy and bitter pill, our emergency room could save a life while demeaning it. Decades of psychological and sociological research explain the behavior of this white-coated mob. But what about the hospital rounds led by senior clinicians? A student, 6 years my senior, wrote a graduation thesis in which he noted that rounds at the patient's bedside almost never acknowledged the patient's existence. No greeting, small talk, explanations, or elicitation of worries.